back to the VHH Summit 2020. How are you doing? We hope you had a great lunch break with lots of food for the mind. Remember that all the videos are available not only today but also tomorrow at the app. Here on your screen you will find the QR code to download if you didn't do it before. You will have access to networking sessions. Don't forget to join the one-to-one meetings and of course visiting exhibitors and watching videos of all show and tell from today. Okay, now let's continue. Telemedicine has seen a big increase in recent months. I would like to introduce Estefania Oliver, a tech journalist at Crónica Global, who will moderate the panel. Estefania, all yours.
Thank you so much. Thank you for attending this session about how telemedicine has changed our lives. I will introduce first all our speakers. First, César, thank you so much for coming here physically. César Morcillo is the medical director of the digital hospital at Sanitas. Welcome. We also have Manel Peiró, is the director of the Institute for Healthcare Management at ESADE. Thank you and welcome. Eloy Gomez is the hematology business franchise head at Novartis. Thank you so much. Elena Torrente is the digital health development deputy director at DKV. Welcome, Elena. And Pablo Mas is the operations director at Meeting Doctors. Welcome, everybody. And first, I would like to remind all the speakers that this is a debate. So please, if you want to say anything, we'll welcome to express your ideas here, okay, openly. So first, if you don't mind, I think that to break the ice, I will start with a very, very general and big question. What is telemedicine for all of you? So I know that it's kind of difficult because it's a big question. So please, I would like to focus more in 3-4 words. What is telemedicine for you? So we can start with you.
Thank you, Stefania. Yeah, for me, in a short way of telling it, telemedicine, it's another way of doing medicine, but remotely, thanks to technology.
And Elena, what do you think about telemedicine nowadays?
Well, I agree with César, of course. Telemedicine is the delivery of healthcare services remotely and using technology. And here maybe I would also say some distinguish between telemedicine that would be services provided by doctors from telehealth that would be services provided by other health professionals such as nurses, pharmacists or others. But at the end is this providing clinical support with technology and remotely.
Elena, thank you so much. And Manel, what do you think about it? And Eloy?
Yeah. So for me, telemedicine is like, you know, the Darwin theory applied to the health. Is the way we consume health in the present and the future for human beings.
And Pablo, what do you think about it? What is telemedicine for you?
Well, I would say it's obviously a new channel to serve medicine and to serve healthcare services, but I think it also takes us to a different level, a different scenario, where we are providing new things and new services to the users thanks to this technology.
Perfect, thank you so much. We know that this is a special context because of the famous coronavirus 19, and I would like to know more some successful cases about how telemedicine can change our lives. I don't know who prefer to start this time. Elena, maybe Pablo?
Okay. If you want, I can start. I think, well, of course, I mean, I think that the COVID-19 crisis has clearly shown the advantages of telemedicine, both from patients and professionals' perspective, but also from the health system's perspective. And here I think the crisis has shown how telemedicine is useful really to reduce pressure on healthcare services. And what is being very, very important during this crisis, that is avoiding infection risks, like for very obvious first thing, I would say, like benefit. Also accessibility. It offers access to care to those who might have a health problem and can't go to the emergency rooms nowadays because of the situation, but also in normal situations with the people that live in rural areas and can access to specific specialists, and telemedicine gives this accessibility. And also convenience, because telemedicine allows people access care from the comfort and privacy of their home and reduces traveling time. And here, well, I would like to also share here our initiative, Médicos Frente al COVID, that we launched at the beginning of the crisis together with the scientific societies, SEMFIC and SEMI, that we open our platform to offer free online consultations and telemedicine services to all Spanish citizens, thanks to the collaboration of doctors voluntarily that sign up to the platform, and we got more than 800 doctors offering their services to Spanish citizens for free and altruistically. So it's been like really an example of how telemedicine is helping during this situation, in this crisis.
Thank you so much, Elena. I don't know if maybe Eloy, do you want to add any other successful case?
Well, I completely agree with the comments from my previous colleague. Just to complement on this, I would say that if we consider I would say something about Darwin, the Darwin evolution and the evolve of the species, and we also include Maslow theory, the pyramid, the 5 levels of the layers of the pyramid. We have in the ground, in the bottom, we have the physiological needs of human beings, right? So that means the humans, we need oxygen, of course, we need food, we need water, and we need rest, but basically we need health. So so far today, COVID has put over the table that if humans cannot go to the hospitals, we need to evolve. And that means telemedicine, the way of getting this basic need that is health. But for me, it's not only a matter of just how we can get health from the different channels, right? That's very basic. And for me, this is going to be a commodity in 2-3 years. For me, it's just a mindset shift, a change of paradigm. It's what COVID has shown us is that we cannot rely on waiting for people to get in sick and going into the hospitals to get cured. We need to start moving from cure to prevention. And I really strongly believe that the technology / telemedicine is just coming to reshape or rethink the healthcare model. So I can give you an example with this rethink model. If we go into the automobile case, we see that historically cars were just going into the garage when they broke down. But so far, today when we buy a new car, they come with a lot of, let's say, early warning sensors that are helping us to maintain the quality of the car many years. So we are just very much getting used to update prevention or maintenance for all our machines, let's say cars or mobiles or the fridge at home or the washing machine or whatever. But unfortunately, we don't do the same with the most valuable asset that we have so far, that is our life. So for me, telemedicine is a change of paradigm, is a change of mindset, and it's just moving the healthcare system from sickness to wellness. So how can we really change and make this system affordable for the next coming years?
Eloy, and I really enjoy the case that you say about the cars and how we can change some industries, and for sure health is more important, right? And sometimes we need to move forward. And Pablo, what do you say about that? What do you think about that? Like, I know meeting doctors has increased the use by 5 times during this pandemic situation, so I know it was very successful tool. But any case that you would like to share with us? Any example or any specific case that you think that we can see very quick how telemedicine can help everybody, especially nowadays?
Yes, thanks. Well, I think that what COVID has provoked is that something that was already a tendency now or a trend, right now it's almost a need. It's no longer an option, it's a need. And I agree with Eloy with the change of paradigm that unfortunately sometimes it happens. We need to something strong to happen to focus on this new situation. No? Before going into the concrete case, I would say that since from our approach to telemedicine, we put a lot of effort in the immediate answer. So we believe that time has a lot of power, and telemedicine, one of the strongest points that provides is that you can at least provide some preliminary help to the user and to the patients immediately, and this is a strong pillar of our service. No, other than making it more accessible, easier, we think that in 2 clicks you have to be able as a user to talk to your doctor, and this is the way we think and we provide our solutions, and it also makes it more efficient for the doctors, because we allow with telemedicine to address each patient and each need to the adequate health service. No, having said that, some concrete examples is that during the pandemic, our solutions have helped the public health in the Basque Country to help primary attention doctors to connect with special doctors in pneumology and in the coronavirus specifically, to help and to provide a better attendance to the patients. And two quick indicators that I can also share is that we have seen that between 60 and 70% of all the online consultations that we get, that we are having more than 100,000 per month, 60% of those have avoided a physical visit to the doctor. That shows the power of telemedicine. And another strong indicator is that 80% of people that has a mobile application of meeting doctors in this case, 80% of those retain this mobile application in their smartphones after a year. No, that is a really strong indicator that is giving us the result that they have used it, and they are willing to use it again because it has worked well with them. Thank
you so much, Pablo. I think for sure telemedicine can help us because we don't have time enough, right, Cesar? I think like sometimes we rush all the time and we are so stressed, and also we don't have time even to go to the doctor, and especially nowadays this difficult situation is pushing us to try different ways. And also I think in that case technology can help us a lot. What do you think about that? I mean, I know in Sanitas you just developed a very strong platform, but any successful case that you want to share also with us, or anything that you can explain to us to see very quick and to understand better how telemedicine can help us?
Yeah, absolutely. At Sanitas, as you say, Stephanie, we have many successful cases, but just let me tell you briefly maybe two examples of them that, as you said, technology helps to humanize this situation. No? For example, on February with the COVID-19 pandemic, all our healthcare centers were focused just treating patients with the virus. So thanks to telemedicine, we help to offer a connection with these people with doing more than 5,000 video consultations every day. Another example is another phase of video consultations that we've been using video calls to communicate with admitted patients to the hospital with COVID-19 infections, avoiding entering in the patient's room and reducing the risk of spreading the infection, for example.
Thank you so much, Cesar. I would like also to share with all of you, especially in this year, with all the COVID-19 situation, ESADE and Barcelona Health Hub have published a report about how telemedicine can help us. And one of the conclusions that I think it's one of the biggest that we can share is in Catalonia. For example, the 85% of the hospital outpatient visits in April were done by phone and not in person. I would like to introduce Manel Peiró at ESADE, from ESADE. Please, Manel, can you explain to us more about this report and some of the most important conclusions from it?
Very much, and I'm very sorry because problems with the key of the place where I am now. In fact, this study that shows that the use of telemedicine in Spain, I guess that we obtain certainly some conclusions that can enrich the discussion and can offer the possibility to make some improvements to the use of telemedicine. We observe that there are some barriers that make more difficult the extension of the use of telemedicine. For instance, regulatory barriers, or simply the training and experiencing, or financial barriers, or even barriers related with the safe use of the connections and the data of the patients and the video consultant. I guess it is a factor that we consider is that in Spain, a situation of privilege in the use of optical fiber, because it makes put the country in a complete different situation in comparison with many other places in the European Union. And in fact, you were talking now about the pandemic and the months of the confination that we were confined, and it was a massive use of the network, and the network works, and that, I guess, that is the best news that we can obtain from this dramatic experience. On the other hand, now the use of the telemedicine and virtual consultation give us some advantages and add some value in the study that we made appear important. It's in one benefit for homes. That means there are no differences with in-person consultations. Secondly, the patient experience itself, the patient is satisfied. There are avoid cost tolls and even time, are shortening waiting lists. For the professionals too, they are satisfied, and they consider that they are giving a similar quality than in-person consultations. And finally, for the sustainability of the healthcare system, that
Thank you so much, Manel. I'm so sorry because we have some technical problems, but we will solve it as soon as possible. So if you don't mind, we are going to go forward with the session. And I would like to also to ask the other speakers. I understand that telemedicine is very necessary, and we could see that. But for example, in your case, Elena, I know that the KV has also a system, and a specific system for telemedicine, and I suppose privacy, security, confidentiality are very important in that case, right? And I suppose some users are kind of afraid of sharing their data to those new systems. How do you manage that specifically?
Yes, indeed. I mean, privacy and confidentiality are like key issues for us, are fundamental aspects. In fact, well, we've been working for the last 6 years, more or less, in developing a complete digital health ecosystem that is person-centric, design, and that offer several services, digital health services that go from health promotion to medical attention. And here, for sure, telemedicine is one of the services. We started like 4-5 years ago with offering online consultations 24 hours with family doctors, and we now through chat and video consultation, and we are now covering a wide range of specialties such as traumatology, gynecology, pediatrics, etc. We also saw during the pandemic a huge increase of the use of our telemedicine services. And with regards to security, as you were saying, this is a really issue for us, and this is why we have developed our own technology to really reassure this. Here I would like to talk about two things that really is in what we are working to really offer and guarantee really security for our clients. First, we have developed our own layer of communications has been developed in Ireland with a specific architecture to really ensure end-to-end encryption. So this really guarantees the highest levels of security and confidentiality of health data, which is key. And second, we also work to a telemedicine which is complete and that really offer a complete virtual cycle of attention for our clients. We cover all legal requirements, and this means informed consent. It means identification of the doctor. It means resolution capacity, so the possibility of doing a previous anamnesis with an artificial intelligence symptom checker, but also request of diagnostic and complementary tests, electronic medical prescription, and here we use the single prescription platform that is homologated by the OMC. And also continuity of care. And here we register all the consultation on an electronic medical record. This is also according to the law and to the law de autonomía del paciente. And also we have the possibility to share documents with third parties to really ensure the continuity of care. So yes, responding to answering to your question, of course, yes, it's a key issue. It's for us also we talk about. We like to talk about telemedicine with guarantees. Not everything is telemedicine, and we have to really be accomplishing all the legal aspects and also for ethical reasons, of course.
I also think that security is very important, and in that way, Cesar, for example, I know also Sanitas has a specific platform. Do you think the users are afraid of sharing their own information? And also with your platform specifically, how it works and if it's easy to use, or what are the main, the most important aspects that you try to improve, to give the best experience possible for the patients?
Well, that's a good question, absolutely, because the information, as Elena was telling, no, and patients sharing their data, I think it's not a problem. When you ask them to share the data, if it's useful for them, they will to share it, so this is not a problem. And that's so that in Sanitas we've recently updated our telemedicine platform it's called a new product called Blue IU. We offer 4 new digital solutions. The first one is that through the app, the customers can ask not just an appointment with a usual doctor, but an immediate appointment with any specialist through video consultation or a telephone call. The second one for me is a game changer solution, trying to help our patients and doctors as well with the physical examination that, as you know, is one of the limitations of the pains of the video consultation. Now, through the phone camera, you can check the vital signs. I mean, the heart rate, the respiratory rate, even the blood pressure without touching the patients. And they can share this data during the video call. The third solution we've been improving is our connected health remote telemonitoring platform with new wearables connected through the app to the medical team to improve the management of many chronic conditions and COVID-19 as well. And the last one is that we have a new digital preventive programs trying to help our customers as healthy as possible with many digital tools like nutrition or even a personal digital trainer that you have to try to be as fit as possible, for example.
I can say that I tried also the facial recognition, and it was amazing, right? And it was very quick because I suppose that time also is very important here. I don't know, this question is more open for all the speakers, so please you can share anything you think or you want. Like, how is the feedback that you receive from patients and users about these new tools? I mean, I don't know if they repeat when they use the first time, or they are more careful about it, like maybe I will try, but they are doubting. What is the feedback in general? I don't know, in that case, for example, Pablo, in meeting doctors, what is the feedback that you get from your clients and also from some other patients?
You touch a really good, really strong point, no? Because we can work on elaborating our best platforms. We need to see if the users are perceiving all this value, and we continually ask the users to provide feedback to us, and we have above 95% of user satisfaction. We also use the more demand indicator, the Net Promoter Score, where we are around 65% of a Net Promoter Score, which is also considered excellent. And in the end, I would say that also the qualitative feedback that we have got from the users is one of the pillars is that solutions are immediate and that you talk directly to a doctor in 2 clicks. In a nutshell, I would say that this is a concrete feedback that we've got from the users.
Thank you. Anything else? I don't know if Manel, Eloy, Elena, anything else that you want to share about the feedback from users, if it's very, very positive, if they repeat when they use the telemedicine?
I completely agree with Pablo. In my view, as a customer, in this case from Sanitas platform, and as a leader from Novartis, you know, it's like we are just moving into just getting a drug into feeling an experience, right? It's like moving into a different segment, like with Amazon or Netflix. if you look at these kind of companies that really provide something different, it's like that they're just getting what the customer is needing. It's a great experience. So and with telemedicine, considering that the 5G technology is coming and it's multiplying the speed of internet, and we're just having these devices, and we can do everything with this just in time, real time. It's like we are moving very fast into the concept of self-care. That for me it's really key. In order, as Manel said previously, in order to keep the sustainability of the system. So rather just to provide a cure, we are just educating the society just to get to go for the prevention mode. I mean, so there is a perception historically in our mind that when you have a doctor's appointment, it's just because you're sick, right? I think that with telemedicine and this easy and friendly way of touching and taking care of your health, it's much more open for all of us to really play in favor of our wellness and avoid all the potential diseases that are, in some cases, I call them the silent killer pandemic. That is not going to be also the COVID, but also all those diseases that are not being diagnosed so far today because we cannot physically go to the hospital. So in one hand, I think it's a great experience that will also engage all of us to really go to the prevention healthcare system, right? So in a few years, my wishful thinking is that we very much take care of ourselves by using this telemedicine and different platforms and innovation and technology, avoiding heart diseases in the future.
Eloy, in that case specifically, I would like to remind that Novartis has developed a pilot for a public hospital in Spain. And I suppose it's very important, specifically with this context or environment that we have now, a very close collaboration between the public system and also the private system. How do you get that? I mean, I suppose sometimes it's not that easy that we would like, but how do you find a way to work closely to fight against a virus like COVID-19?
Yeah, that's a very good question, and I think we have a double speed here. The private insurance companies, healthcare companies, are working much faster, but unfortunately the public system is just it's much bigger, and it goes in a slow way, right? So it's a must that the private companies, the public companies, and the technological companies work in the way of co-creating the new solutions and services and experiences for the population, right? And that was the case, particularly in Novartis. We were just thinking, how can we be effective in this new situation of COVID, and how can we help patients in order to get through their medicines and medication. And we start piloting with, as you said, particularly with Ramón y Cajal, that was one of the biggest hospitals in having the impact of COVID in Madrid, Spain. So it was not that easy because there are a lot of stakeholders that are in the decision-making process. Not only the physicians and the hospital managers, but also the technical information system of the hospitals, the data privacy, as Elena said very well in the past. So we need also to open our mind and to keep and to trust in the technology, in the blockchain ways of and secure the information, because as we are used to get trust on the banking system, so far today we go into the cell phone and you look at your bank accounting and you trust and just taking care of that information. We need to trust on the technological providers that are getting secure of our information, because so far today, the barriers or the hurdles that we are facing so far in this pilot is just to making sure for all the stakeholders that the data privacy of the patients are remaining safe in these different platforms. So this is a journey. We are in the starting point in the public hospital way, but I think we are going to explode very soon the way of doing it. The first one in breaking the wall is the one that is starting to bleed. But I'm sure that a lot of learnings from this pilot are gonna help for just scale up and move faster in this direction for the rest of the hospitals.
And thank you for all those examples, Eloy. I don't know what Cesar, Elena, or Pablo think about it. If it's really our public health system is like a big elephant, and any move is very slow and it's very hard, or it's more like an elephant who's trying to walk faster. What do you think about it, about our public health system? It's difficult to work with them, with the old system. Has Spain a very good public health system, but sometimes it's difficult to rush some things like telemedicine or to work together? What do you think?
Well, for example,
Cesar or Elena, Pablo, who wants to start first?
Whoever. I will just jump in really quickly. From our side, we did manage to work together with the public health, as I said, in the coronavirus, with the Basque Country. But I think that the point that we are starting from, it's, as Eloy was saying, it's really the start point. Maybe what we have experienced is that sometimes we try to make the perfect project that is covering all the needs, and this is really difficult. And we strongly recommend, from in our humble opinion, because we are the smallest here for sure, is that we try to put the project in pieces and start with a minimum viable product, launch it to the market, provide some test and learn from the users, and from then build on that. And we do that because we work only business to business. We work with companies, so we try to push a lot on that to the companies, and not trying to achieve today what maybe you need to achieve in 12 months or in 18 months. But let's start moving today. Maybe this is only our point of startup methodology here.
Thank you. And Elena, what do you think about it, about this collaboration?
Well, I would say, like, in general speaking, that I mean, we have one of the best health public systems in Europe and in the world, but it has been very stressed because nowadays, because of the crisis, it's been in a high pressure, and one of the clear examples is primary care, which is like it's being submitted now on a huge pressure because of the crisis, coronavirus, and it's really difficult to really work on the systems that are like exchanging information and so on, and this is why it's so important to work on interoperability issues, so that this exchange of information can be done when it's possible. And, well, I would like to come back to the previous question also concerning satisfaction of patients and our clients and so on. Here I would like to also say that we conducted some surveys during the crisis, the medical frontal COVID project also, and we got like very high satisfaction with 90% of users saying that they would recommend the service. And here I think the important key point here beyond technology is the health professionals that are behind telemedicine and that are the ones that are offering the medical advice and the service. And really, of course, we need to, as companies that we are deploying telemedicine platforms, and we need to work strongly on usability issues and making this technology easy to use and make it easy for users to get the services and to do, as Pablo was saying, to in 2 clicks having access to that doctor. Okay, of course we have to do this, but we really need to ensure that the quality of health services that are provided through this telemedicine are high. And for this to really reach this, it really needs to be embedded, or like the services need to be recognized as a medical, as a in-person visit, and it needs to be treated in the agenda of health professionals so that they can manage the telemedicine and visits, virtual visits, as well as in-person visits. And for this, we really have a huge and long way to go from the private and from the public system, so altogether as a health systems, I would say.
And Cesar, what do you think about it? We know that Sanita is a big company for the health system. What do you think about this kind of collaboration, or the how to work together with 2 different kind of systems, right?
Yeah, this is a good key point, as my colleagues were talking about. No, I think during the COVID-19 crisis, we've been working all together with the public health system, with Sanitas attending all patients coming into our hospitals. And I think this is the key point, to work together, joining forces, and this is the only way to progress and help one to each other. Elena were talking about, and the other ones as well. So this is the only way to improve, to innovate. Sometimes you were talking about the elephant movement of the public system. That's so that they need, for example, to learn from other companies that the knowledge to work faster, to improve, and at the same time we can learn from the other one. So this is the only way to improve.
Yeah, because I suppose that sometimes private system has some tools that public system doesn't have, right? So I suppose it's very important to share and to, like you said, to help each other. But I suppose that in this specific case with all the COVID-19, it's not that easy sometimes, right? Because we need everything very, very fast, and it's everything for yesterday, not even for now, right? But I suppose we will work in that path, in that way. And in that case, I would like to ask Pablo about meeting doctors, and I know that you work with different kind of businesses and industries. I would like to ask you, is telemedicine like just a very specific thing for health system, or other industries can help in that way?
Thanks. From a starting point, as a meeting doctors, we work only business to business. We provide the technology and the medical service that Elena was saying is as important as technology it is, because if not, nothing works. And yes, we have observed that not only, let's say, the health industry, that we started working, for example, for health insurance companies. Then we also broaden our services to public hospitals or health players. And now we are working, and I think this is good news regarding what Eloy was saying about, we work to tackle wellness, not to tackle illness or sickness. And how do we see that? Because we are, for example, with one of the largest banks of Spain, and you would say, what a bank has to do with telemedicine? Well, the bank wants to provide value to its customer portfolio, and they want to a certain segments of their customers to provide something that is worrying them, something that they are going to use, and something that they know that they're going to be satisfied, because we are showing some numbers that people is satisfied after using it. No, one example would be banking. We are working with pharmaceutical companies. They want to be branding some projects that position themselves, let's say they position themselves better than their competitors, because they are providing, for example, expert gynecologist advice, since we are doing, for example, with Bayer. And another industries are travel industry. Travel has been really damaged in this coronavirus, and they need to add something different to attract customers to the hotels, or even to book a flight. So now they are saying, okay, I'm gonna provide you the flight, I'm gonna provide you the hotel, but I'm gonna provide you also some medical assistance online, so you can travel safe and you can travel happy, no? And travel and also telco is another sector that we are working on. So what do all those sectors have in common? Basically, they see that this is used. They are providing a service that is used. They are seeing that it is highly satisfied, the users, and we are generating, this is also important, we are generating business for them as a company.
Pablo, and in that case, I would like to ask a general question for everybody. Do you think telemedicine, the use of telemedicine, is gonna decrease after all this pandemic situation, or is just here to increase every year? What do you think, Cesar? You are laughing about that, so you can start.
Of course, yeah. Have you seen the title of the of the telemedicine platform? Of course, it's here to stay. It's increasing. We have the numbers, for example. No, everybody. You were talking about the engagement of the patients. We have a really high engagement. 90% of patients who test and use the platform, they repeat doing a video call. This is so high. And after now, we already. Well, it looks like maybe a month before now it's increasing in Barcelona again, but patients can now go to the hospital again, and they are still using telemedicine because they have seen not just the customers, the patients, but also the doctors. Everybody is so happy with telemedicine, and they prefer using now telemedicine because it's more convenient for both.
Thank you. And Elena, what do you think about that?
Yeah, I completely agree. I mean, it has come to stay. We have come back to the levels. So I mean, we are not having the same levels that we had during the April and March and April of uses of telemedicine. Of course, it has gone down a little bit, but it's much higher than it was before. And this, of course, is because nowadays, once people has experience of it, they will keep using it when necessary.
And Eloy, what do you think? Is telemedicine here to stay stronger?
I cannot agree you more, and I cannot be more appreciated, and I just thankful to Deca Uves and ITAS and Meeting Doctors and all these players that are really bringing all these services and experiences, because it's quite a paradox that in this century you can receive at home any single service but health. If you need anything, you can get it from any provider in 24 hours at home. But until now, if you want to just to keep you healthy, you have to go physically to the hospital. So for me, this is going to be a must. And my wishful thinking is that very soon it's going to be a commodity, that no one is going to just question this. So, and especially just imagine people like me that are coming from a little village in the particularly in Segovia, that just to go to the hospital, you have to drive 100 kilometers back and forth. So, just to have with this 5G new generation wireless and and the mobile new generation, it's an awesome let's say progress to have this telemedicine. So thank you very much, guys, for making this a reality.
Thank you so much. We don't have so much time left. I think the time goes really fast, right? And this is a very important thing. Thank you so much for all the speakers to be here virtually and physically, of course. And we will have this panel, this session online on the YouTube channel of Barcelona Health Hub. So please visit the YouTube channel and just check everything you need. Thank you so much, and I hope to see you soon. Thank you.
Thank you. Bye-bye.
Thank you very much, Estefania, and all of you, all of our experts.